Hey, most people are very confused about the full retirement age. If you're 65 years of age this year and beyond, you're probably confused about exactly when can you draw full Social Security, when is it going to be discounted, how much increase happens if you're going to suspend and not draw your Social Security, and then how does that apply to your Medicare? Stick around, I'll be back in just a second to go over these details. Hey, so there's always been this big confusion on when does Medicare start and then when does your Social Security full retirement age begin. Often people, when I first got into the industry, understood it to be based on when they're 65, both Social Security began and Medicare begins, but there's actually a full retirement chart that lets us know exactly who can qualify for full retirement Social Security, and you don't take a discount on your Social Security benefit, or if you wait and draw your Social Security beyond your full retirement age, how much increase can you acquire over and up to the age of 70 years of age. I'm going to walk you through just the details of it so you understand exactly who can and what can a person qualify at the age of 65. And then how does full retirement with your Social Security tie into this, and explain the details for you. So one, if you have a birth date year of 1937 or earlier, at 1937, you would be 88 years of age. Right now, you would have actually been able to qualify for full retirement age for your Social Security, which means 100% of the dollar that you paid in through FICA taxes would be paid to you based on your Social Security benefit earnings. You would qualify for at the age of 88 years of age. And then you would also qualify, as everyone does, at the age of 65, all Medicare eligible folks that have paid in FICA taxes, or if you're a spouse, and you're going to be drawing off of another spouse, you at the age of 65 years of age would qualify for your Medicare Part A and Part B. Now, if you're working, you're going to be on an employer plan and you're going to be working to the age of 67, 78, it doesn't matter what the years are. You may not go on Medicare, depending on your situation. We have videos about that apart from this video. But to explain the full retirement age, it's based on the year of birth, 1937 and earlier. That would be 88 years of age and older. So at 88 years of age and older, you would have been able to qualify at the age of 65 for basically 100% of what was due to you for Social Security. Now, if you are looking at this from the age of 1960 for your birth date year, 1960 or beyond, your full retirement age is going to be 67 years of age. So that means if you draw Social Security at 65, we're going to talk about exactly how much does it discount it, or if you wait past the age of 67, how much of an increase can you acquire all the way up to the age of 70. So if you're at 70 years of age, Social Security is going to require you to draw Social Security benefits. I'm going to go over these numbers with you in a second. And then also in the description below, if you'd like to have a copy of this, it's going to have a copy of the full retirement age and the scale. And to simplify this for you again, if you are have been born in 1960 and beyond, like for me, my birthday year is 1975. This year I'll be the grand old age of 50. Well, guess what? If I'm going to draw the full retirement age for me is going to be 67 years of age, but I can qualify for Medicare Part A and Part B at 65 years of age. So this chart has nothing really to do with your Medicare eligibility. If you're turning 65, you qualify for Medicare Part A and Part B. If you're on an employer-based plan and you're going to remain on that, you may need to go on Medicare, you may not need to go on that. If you're not educated on that, we have videos for that, or you can call in the office. We can educate and walk you through the process of whether or not you need to go on Medicare Part A and Part B, and then go on and stay on your employer plan. If you're qualifying for a retirement plan, you're a federal, state employee, or TRICARE for life recipient because you retired from the military. Typically, you're going to be required to go on your Medicare Part A and Part B at 65 years of age, and then you would stay on your retirement plan. So if you are retiring, or if you're on an employer-based plan, and you have questions and the confusion of Medicare and Social Security comes up, this is the full retirement age. When we talk about this is always talking about Social Security and when can you begin drawing Social Security to qualify for what I would call the 100% amount owed to you. And this is going to be the chart that you can download, print a copy of, or look at, or if you have questions about, give us a call. But again, if your birth date is 1960 and beyond, you're going to qualify for full retirement at 67 years of age. Any year prior to that, all the way to 1937, you're going to subtract 2 months based on your birth date year. So 1958 would be 66 and 8 months, or excuse me, 1959 would be 66 and 10 months, which is 2 months. 1958 is 68 and 8 months, 1957, and so on. So basically, for each year, 1 year equals this 2 months of discount. So based on when you were born, based on your year, is going to determine when your full retirement that reflects to your Social Security. Okay, in just a second, I'm going to show you another one simple page of how much increase and decrease if you start drawing Social Security prior to your full retirement age, and explain that to you in detail as well. All right, so let's look at the rise and fall. So if you draw early, what's going to happen if you draw later past your full retirement age? Now, we're going to use your birth date year as an example of 1960. And so if we look back at the chart, that means your full retirement age would be 67 years of age. But let's say, hey, I am going to retire from my job. I'm going to go on Medicare A and B at the age of 65, because that's when you can go on Medicare A and B. And I'm going to go ahead and start drawing my Social Security at the age of 65 as well. What's going to happen to my full retirement age or full retirement benefit? So let's just say that you have an income that's going to be coming to you of $2,000 for your Social Security benefit. What is going to happen to that? You're going to take 6% off of this for the first year, and then you're going to take another 6% off of that for the second year, and you're going to have a discount, and I'll show you in just a minute on a white screen exactly what this is going to look like. So if you draw early prior to your full retirement age based on the chart earlier, and again, if you're a 1960 baby and beyond, like some of you guys that are turning 65, and then like myself, I'm 50 years of age, I've got 15 more years before I go on Medicare. I'm going to have to wait to 67 years of age based on what my full retirement income for Social Security is going to be. This is just an example. So with that being said, what's it going to look like if you wait? Okay, so what happens to this 1960 baby? You're born in 1960, you're turning 65 years of age, and you are saying, hey, I'm going to wait until I'm 70 years of age before I draw my Social Security. Tell me exactly what happens to me, because your full retirement age is 1960 and above is going to be 67. So what happens at this time gap? Well, to keep this very simple, we're going to go down. You're 67, 68, 69, and 70 years of age. You qualify for Social Security full retirement age. Your FRA is going to be 67. So for each year, you're going to have an increase of 8% more per year based on your full retirement age income, okay? So if your full retirement age income at 67, let's just say it's going to be $3,000, or the example earlier was $2,000, just to keep this math simple, then you're going to have an increase of 8% here. You're going to have an increase to that here, and it's going to be a compounding effect. Now, another thing that's going to fall into play of this is going to be the cost of living adjustment. So you're going to have a cost of living adjustment on your Social Security benefit as this goes up, plus the 8%. So we're going to talk about that in just a second on a white screen. I'm going to do the math for you to make this simple and hopefully eliminate some confusion around some things regarding, again, Medicare and Social Security. All right, so let's explain the details that some of you guys may know. If you don't, I'm going to simplify this. So when do you qualify for Medicare? At the age of 65, okay? When do you qualify for Social Security? Well, that's going to be based on your birth date. Again, year, okay? So for babies, and we're going to look at this from, if it's a birth date year of 1960, then your full retirement age to start drawing your full retirement on your Social Security benefits is 67 years of age. And why is this important to understand? Well, some people think, hey, I got to wait to start doing my Medicare stuff until I'm 67. So here's where you can get yourself in trouble. If you qualify for Medicare Part A and Part B, you're going to be required to pick up a credible coverage Part D plan. And there's a couple ways to be able to do that. I'm going to explain that in just a second. But if you do not go on to Medicare and you do not have a credible coverage plan like an employer-based plan or TRICARE or a veteran, and you don't sign up for your Medicare Part A and Part B, and then you're waiting until you're 67 because, hey, that's when I draw my Social Security, that's when I'll start qualifying and going on Medicare. What's going to happen here is you are going to be penalized a percentage on your prescription drug plan benefit. And Part B of Medicare. Medicare has two parts. You guys, if you've not watched our educational content on explaining about how Medicare works, well, you're also going to fall into a penalty with Medicare Part B, which I'm going to cover with you now as well. So what happens to these different parts, and then what happens to you if you don't go on to Medicare at the age of 65? So again, this is going to apply to you guys. If you're like me, I'm self-employed. When I turn 65, guess what? I will go on to Medicare Part A and Part B. I am going to have a Part B premium. That is going to be a dollar amount that you're going to pay per month. This increases each year, but you're going to go into a Medicare and you're going to pay a Medicare Part B premium. Okay, Medicare Part A, you've paid in by paying 40 quarters or 10 years of FICA taxes. For us, it's paid in taxes, depending on if you're doing a Schedule C, if you're doing a W-2, a W-9, I mean, all the different the moral of the story is you're paying in FICA taxes. So if you're paying taxes, you've been paying in enough quarters, then you have to pay in 40 quarters or 10 years of taxes to qualify, or what I like to say, be entitled to Part A at no cost. So Part A is what I call the entitlement of Medicare. You're entitled to it because you paid in enough FICA taxes, which again, 40 quarters or 10 years. Part B is what you pay for, and Part B is all outpatient. So if you're doing anything outside of the hospital, it's going to fall under Part B. That's going to be like your doctor visits, specialists, outpatient surgeries, diagnostics, and things like that. I won't get into all the list, but here's what happens. On Part A and Part B, it enables you, if you have Part A and or Part B, so if you're 65 years of age and you're going to be working, you may go on to just Medicare Part A and not have Part B, and then you may have a qualified credible coverage Part D, which is for drugs. You're going to have a drug plan that you want to be on. Again, we're talking about penalties and what happens if we don't enroll into this, but how we can enroll and how we're entitled to Part A, how we pay for Part B. So if you're on an employee-based plan and you're not going to be going on to Medicare, you're going to be covered because your plan, more than likely, is going to be considered what's called credible coverage. And so with credible coverage, you will not have a Part B penalty, and you're not going to have a Part D penalty. For everyone else, when you turn 65 years of age, this is very important to remember. Everything that happens for anybody that's turning 65 years of age, prior to and thereafter, you have this window of time, I like to say the 7-month protection window. 7 months. And why do I say that? Well, 3 months prior to your birth date month, and then 3 months after is when you can actually enroll into Medicare Part A and Part B. You can go into Part A plus Part B, plus you can enroll into like a Medicare Advantage plan or a drug plan, or you can choose to go on to a Medicare supplement plan. Medigap is what those are called, Medicare supplement, Medigap. This is going to be like, for most of you guys, going to be like a Plan N, Plan G, or Plan N. For most of our clients, Plan G is what they choose to do. Again, both of them are good options, and we would educate you on the differences of the two. Then, if somebody chooses to go on a Medigap, they're going to have to pick up a Medicare Part D plan, because Medigap only covers Part A and Part B services. Well, back to the 7-month window. When do I do all of this and choose my plan or choose a Medigap plan without having any penalty? Well, you are going to do this in what I call the 7-month window period, normally referred to as the IEP, initial enrollment period. This is going to be the period of time that Medicare is going to not penalize you if you're qualified for Medicare and you're going on Medicare. You want to do it 3 months prior. I always say start here on the first month. So August is my birth date month. For you guys, if you need to know, August 13th is my birthday, and I can always do well with a birthday card or a gift card if you want to send me something special. But this is the 8th month of the year. So if I look back and I go, when would I begin the process to enroll into Medicare? It would be on on the May, June, July. It would be May that I'd want to choose to do that. Why? Because we're dealing with the government. And when we deal with the government, with Social Security and Medicare or anything, what takes us this amount of time to do anything usually takes the government this amount of time. So the quicker you start, your Medicare is going to go effective on the first day of your birth date month. So the first day of this 8th month is when my Medicare would go into effect. Now, let's just say you procrastinate and you're like, hey, I never do anything on time. So I waited until the 8th month. What happens? Well, you have 9, 10, and 11. You have September, October, November. If you wait to the September month, you're going to go into effect on 10/1 for your Medicare Part A and Part B. If you wait all the way to the 11th month, your Medicare Part A and Part B is going to start on 12/1, and you are not going to incur any penalties. And I'm going to go over the penalties with you so you understand how the penalties work for Part B penalties and Part D penalties in just a second. Hopefully this visual helps you, but the initial enrollment period, this time frame of 3 months prior, the month of, and 3 months after is this what I call 7-month window that protects you from any kind of penalties, and you can always make an option or a choice in this time period and you're not going to be penalized. So remember one thing that I said earlier, for you guys that are 65 years of age or getting ready to turn 65 and you are looking to work for a period of time, and let's just say you're going to work for 4 years and you're planning on retiring at the age of 69. What is going to eliminate you from being penalized is going to be what's called a special enrollment periods. And basically, if you have a credible coverage plan that's going to cover your hospital and your medical and all your needs, your medications and things like that, that you have from your employer at 65 years of age, you don't have to enroll into Medicare until you choose to retire. And then when you choose to retire, this same mindset of what I call the 3 months prior, the birth date month, and 3 months after. Now, this applies, but it does not apply. If you wait and you've been 65, you wait to 69 years of age, you need to make sure everything you do, don't think about after, but think about when you're going to be retiring. Because when you retire, you want your Medicare Part A and Part B to go into effect on that retirement birth date or time frame. So if you're going to retire at 65, the simple way of looking at this, at 69 years of age, if you're going to retire, and let's say you're retiring on the 10th month, you want your Medicare A and B to start on 10/1, and or if your employer coverage for some reason is you're going to retire, say on the 15th of that month, and your coverage is running all the way through the 31st of that month, you would want your Medicare Part A and Part B to go into effect on 11/1. So this again is an example. If you're retiring at 69 years of age and you're looking at like, okay, I'm going to retire around October, you would find out exactly what date are you retiring and how long is your employer coverage going to be covering you. Then you're going to go at the end of that coverage time, your Part A and Part B and your plan choice is going to start on this. Now, why is that important? Well, this 3 months prior time frame that we talked about earlier, and then let's just say your retirement date, RD for retirement date, if this is going to be 11/1 when you're Medicare A and B, you want to do everything when it comes to Medicare, again, 3 months prior. So again, what do we have? 10, 9, 8. You want to start the process in August to ensure your Medicare Part A and Part B fall onto your retirement date. And let's say your retirement insurance or your employer insurance is ending October the 31st. This is going to eliminate any form of penalty, because if you wait beyond this, there's time frames for Part D at 63 days. For your Part B, you don't have to enroll into Medicare Part B until out here all the way up to 8 months. But you miss this time frame for your Part D, and then we're going to talk about the penalties. So guys, I know this is a lot of information. I know it's kind of confusing when you start walking through it. This is one of the reasons why, if you do not have a licensed agent or an agency that you're working with, the importance of connecting with somebody like us that's going to educate you through the process. Our process basically is pretty simple. When you call in, or if you're clicking something below and filling out information, our personal assistant liaison, what we call a PAL, is going to call you. They can be a licensed agent. They don't have to be, but they're going to collect some information, like your personal information, and they're going to ask you questions like, hey, are you retiring? Are you going on to Medicare? When do you turn 65? What age are you? And all these questions is going to be an assessment of exactly what the next step is going to be for you to eliminate. We want to eliminate a couple of things. One, penalties, and then also the big thing for all of us, we want to eliminate any problems enrolling into your options. And this is why you'd be able to call, schedule a time, allow us to walk through the process. And our process and system of how we do this is based off of what I call is identifying the problem and then guiding you through to a solution, and doing this in a simple, easy way so you're educated. So if you don't have an agency that you're working with, do give us a call. We'd love to be able to educate you based on this simple analogy I just showed you. And again, it's just about collecting information and guiding you through and problem solving and identifying a problem. Or communicating to you so it eliminates problems. So one, you may have a problem that you're dealing with and you're trying to find a solution, and or you're unaware of problems that are going to occur. So if this is you, we are going to educate through our process through one, collecting information, two, assessing exactly where you're at by asking you a bunch of questions, and then providing you guidance in the direction that you should go. And so this could be for anybody that's 64 years of age, all the way up to, if you're waiting to retire. My mom retired at 78 years of age. She was not on Medicare A and B because she was on a employer-based plan. And so guess what? At 78 years of age, her mindset had changed about a lot in life, but I just had to handhold her through the entire process. Again, I had to ask my own mom questions, assess and gather the information, and then we assessed the situation, and then I provided guidance to enroll and help her enroll into Medicare Part A and Part B. And then plus we added for her a Medicare plan, and I won't go over the details of that because that's her personal information. So let's break out what happens if you don't enroll into A and B. Well, Part B of Medicare, if you guys have watched this video I've done before on exactly Part B penalty, you're going to be penalized the Part B premium for that year. You're going to have a penalty added of 10% for every 12 months you do not go on Medicare. For every 12 months, you're going to have a 10% penalty you're going to add to your Part B premium. So based on the year that you're in is going to determine what your Part B premium is. I'm going to keep this very agnostic, but your Part B premium is going to have this plus 10% for every 12 months. So if you go from 65 years of age out to 68, and you're like, hey, I'm not picking up my Social Security right now, so therefore I'm not going to pick up my Medicare. Then you're going to have 10%, and then you're going to add 10%, you're going to add 10%. Now, remember when I talked about earlier about this cost of living adjustments, this thing called COLA. This is going to add a percentage. A lot of times it's a single digit percentage. I think it's projected to be about 5.2% this upcoming year. We're in 2025. I think in 2026 it's roughly, but usually it's around the inflation amount of about 4%. Well, that's going to be added into your Part B premium. So you're going to have a Part B premium of X dollars plus the COLA adjustment plus your penalty of 10% for each year again that you do not choose to enroll into Part B when you're eligible and should have gone on Medicare Part B. So it's very important that this amount plus 10% can accrue over a period of time. And we have had people, professionals, a lot of times not enroll. I've seen a doctor one time just say, I'm not paying the Part B penalty based on his IRMA. He was going to have to pay an adjusted amount of several $100s a month. He refused to pay this. Well, guess what? He is going to end up, when he kicks in his Medicare Part B, paying the Part B premium plus the penalties. And again, the COLA adjusts this Part B premium up each year typically, and that goes about 4%. So hopefully this makes sense on the Part B penalty. If you have questions about that, or if you're stuck in a situation where you're like, hey, I've had a problem with my Part B, how do I eliminate these penalties? There are some situations where you can eliminate penalties based on Medicare's rules and regulations. You can always reach out and ask. Hey guys, before I get into the Part D and explaining the Part D penalties, I want to remind you, if you are confused about Medicare, you may be saying, Kelby, some of this stuff I just don't understand. What is a simplified way to understand it? As we like to say, we want to make your life easy by making Medicare simple. How we do that is provide you a free access to our Medicare Made Simple workshops. They are on demand or live. It provides a guidebook and it walks you through everything you need to know from what is Medicare, how did it begin, all the way through to the penalties, to enrollment periods, the full retirement ages. It goes over everything any person needs from start to finish. That workshop that I do is about an hour long. So if you like to take a deep dive and then have that simplified down, we still want to simplify Medicare in the workshop to make your life easy by making Medicare simple. Register below, click and register. We'll send you a copy, or I'll see you on the live webinar here soon. All right, so diving into the Part D penalty. This is a big one because a lot of times people are very confused on Part A and Part B. Obviously, it's a little bit of confusion about the Part B as in Bravo penalty is the 10%. And then plus, again, it's just like the normal cost of living adjustments that occur, and it'd be extremely expensive if you wait when you qualify for Part B. You also need to keep in mind, do I have credible coverage? If you're like me, self-employed, and you're going on to turn 65, you're going to enroll into Medicare Part A, you're going to have Part B, and you need to choose a Part D coverage. Now, Part D comes through two different options. One, you can get it through a Medicare Advantage prescription drug plan. These are the HMO, PPO Medicare Advantage plans, or private insurance companies that have a contract with the federal government. And Medicare Part A and Part B allocates a large dollar amount each month to that carrier that you choose. And they're going to cover your Part A and Part B and Part D all in one plan, and you're not going to have a penalty if you enroll into this when you become eligible. So this is all based on when am I eligible. Now, what I like to tell people, and before I get into just doing a standalone prescription drug plan or PDP plan, what I like to tell people, if you're confused about this, you want to communicate with somebody, a licensed expert, before you turn 65. Don't assume that you understand this, and don't assume that you're not going to be penalized. A basketball coach one time said, you know, what happens when you assume? Well, it makes this of you and this of me. So we don't want to assume. That's what a basketball coach in middle school taught us boys before a practice, because the game before, the boys are running plays wrong. And they said, well, I assumed you wanted me to go there. And Mr. Chapman said, hey, we never assume. And he drew it up on a dry erase board, and it stuck with me forever. So that's why I share it with you. Do not assume because you're turning 65 and your situation is this, that you understand Medicare. Don't assume at 65 your situation is this, that you understand. Don't assume if your situation is this at 65. If you're 65 years of age, back up 3 months, and then from here, make sure you are communicating to a licensed professional about your options when turning 65. This is going to eliminate a lot of frustration for most of you guys that are trying to read and figure out or just making assumptions. Your friend's situation is this. Well, you're not your friend. Your situation may be this, and this situation may have implications right here that cost you a lot of money because of the penalties and processes. And the sad thing is, if you don't choose at the right time, you could be pushed out until the GEP, the general enrollment period, which is going to be the first of the month through the third month of the beginning of the year. You may go 6, 7, 8 months without health coverage just because you made an assumption. We don't want to see that happen. And then back into the penalties here in just a second. So Part D penalty, this is going to be very simple. Just equate it to if you don't go on a Medicare prescription drug plan at the qualified time, you're going to be assessed a 1% penalty towards the national prescription premium average. Now, this average has always kind of ranged anywhere from about $37 to about, I'm just going to make this very simple math. Do not hold me to these numbers, but this is kind of the average. So that means, hey, I'm going to be charged about 35 cents to about 47 cents for each month, and this is accrued on a compound basis. So if you qualified for a Part D plan on, let's say, 8/1 of 2025, and you just bounce along for month after month after month, and all of a sudden you've got 36 months later, you enroll, you're gonna have this penalty times 36 months is going to equate out to the dollar amount added. It's going to be added to your Part D premium. So if the Part D plan is a standalone Part D plan, you may have a premium of $25 per month for that Part D plan. Well, guess what? The penalty is going to be based on that 36 months that you did not have credible coverage plan times, let's just say it was 35 cents a month. You're going to add this dollar amount to your premium, and that is going to be the total cost, the penalty plus the premium. And this is why it's very important to make sure you have Part D coverage when you are eligible for Part D coverage and not suspending it or going, hey, I'm healthy, I don't need a Part D plan. There's a way to enroll into Part D coverage at a very low cost. If you're choosing to enroll into original Medicare and going on to like a Medicare supplement or Medigap, you're going to choose a prescription drug plan. Sadly to say, there's agents out there that love to enroll people into Medicare supplements, but they hate to deal with the details of prescription drug plans. Prescription drug plans are based on, formularies. That's the medications you're taking. And you may have a long list or short list. They're also based on what we call, formulary needs. So formulary determines how much is the cost of Tier 1, Tier 2, Tier 3 drugs, Tier 4 drugs, which gets more expensive, and then Tier 5 drugs. And then also based on this, you have pharmacy networks. And so based on who your pharmacy is determines whether or not that plan is going to be a good fit. Well, guess what? A lot of agents don't like to cover the details of all of this with you. They'll enroll you into a Medicare supplement and do the application and submit it, but they don't like to get into the weeds of doing the hard work when it comes to prescription drug plans. We personally do all of it. So if you call and you're looking at different options for a supplement, we're going to communicate and educate you on the Part D, but this is why you need to be leery. If you're talking to somebody that's just going to put you in a Medicare supplement and they say, hey, I don't do prescription drug plans, that would be a warning sign to me. But if they say that, make sure you're talking to a licensed agent or an agency that does the drug plans and goes over all these details to ensure that you're not paying more in money based on this penalty that we talked about, which is 1% again of the accrued or compounded penalty over the months that you don't have a drug plan coverage. So guys, just to make sure, as we recap real quick, and I'll just walk you through some important information. Your full retirement age deals with your Social Security. That's going to be based on the year that you were born. Again, 1937 babies, if you're 88 years of age or older, you're going to qualify for full retirement age for your Social Security at 65. For most of you guys, a lot of times that you're watching our content, your full retirement age is 67 years of age, but this does not have anything to do, has any implications on your Medicare Part A and Part B, which we've gone over. Make sure you understand that Medicare A and B is driven off of the age of 65. And make sure, guys, that we go back here 3 months prior and we begin to make decisions with our Medicare 3 months prior to your birth date month, which would be your 65th birth date. Again, you may not need to do anything. You may need to do something based on what I've shared with you. You need to know and be educated on your options and to eliminate the penalties, just to know. Don't assume that you understand. But based on this full retirement age scale, a lot of people now are getting confused because they say, hey, can't draw my Social Security until 67. I'm just going to wait to do my Medicare, and then they're going to have Medicare penalties. They're going to stay with you for the rest of your lives. If you have questions, guys, reach out to us. We'd love to be able to educate you. Lastly, if you have not liked, subscribed, and hit the bell icon, please do that. You'll get a notification every time I put out more content like this. We're here to be able to educate you and make your life easy by making Medicare simple.